Now, a new life-saving scheme has been launched in Cumbria. Blood bikes will see volunteer motorcyclists providing free, out-of-hours transport for blood and medical supplies.
Blood transportation is an expensive business. In Cumbria alone, 700 units of blood are used a month across our hospitals. That equates to 23 units a day. Hospitals in our region also transport between their sites 4 or 5 times a week, with 2 or 3 of these urgent transfers.
Well, now anyone with a motorbike licence and a willingness to learn could help. Fiona McElwraith reports on how having blood bikes in our region will be a massive benefit for our hospitals.
They're now part of a life-saving scheme. These blood bikes will be used throughout Cumbria and southwest Scotland to support NHS transportation services of blood and medical supplies, and it's all voluntary. Motorcyclists across the region have signed up for this scheme, which will provide free out-of-hours transport for blood between hospitals. It's the brainchild of Bill Bertham from Carlisle. His wife was diagnosed with non-Hodgkin lymphoma, a form of blood cancer, in 2011.
Most of the guys that want to come along and join us want to give something back to the hospital. In my case, my wife contracted cancer and she was treated successfully, and I could see I had to do something, and this is what I did. I set up this organisation, and I'm proud that it's working so well.
Distances between West Cumberland Hospital in Whitehaven, Cumberland Infirmary in Carlisle and the other hospitals in the region are large. It means the delivery of well-maintained medical supplies at short notice can sometimes only be done with the use of taxis. But now, thanks to the blood bikes, that'll change.
There is a level of urgency about this. We can't just use a taxi because they're not really accredited. And when I heard that blood bikes had an opportunity to set up in Carlisle, I was extremely enthusiastic. It offers a great opportunity to help not just the 2 hospitals but also all the patients in Cumbria.
Already over 30 bikers have signed up for the scheme, but it does mean more than just turning up and riding. All registered blood bikers will need to go through a rigorous training programme before getting accreditation to ride for the service.
The bikers can actually use their own bikes, or they can use the liveried bikes that we have. If they use their own bikes, they simply have to take a short assessment to see that they are safe in what they do. If they want to use the liveried bikes, they have to be an advanced rider with the IEM or ROSPA. Bikes are equipped with blues and twos, so we do a little bit of training for blues and twos so that people are aware of what's required when they're being used.
Now vital blood supplies can be transported for free. It means funds previously set aside for taxis can go towards patient care and other key NHS frontline services and ensure that more lives are saved by this innovative service. Fiona McElwraith, ITV News.